Good morning, everyone. It's really great to see everyone back. And those who are new, just a little video and camera etiquette. This learning module, this learning community is being recorded and we do have participants on. We ask that you keep your camera on and remain muted until you're ready to speak. And we also have some observers who are joining us and we ask them to keep their camera and audio off. They're on participant and listen only mode. So let's go ahead and continue. So we are continuing with our learning community for organizational leaders on capacity building through collaboration between organizational leaders that provide behavioral health services to refugees and migrants. I am Dr. Lizzie Ortiz Mendez. I'm currently serving as the project director for RMTAC. As a co-host today, I have Dr. Brandon Osborne, who is the senior research associate with RMTAC. And here's a brief look at our agenda. We're doing some brief welcomes, introductions, and icebreakers. We'll have a presentation overview reviewing the information from last session and what we'll be doing this next session. We'll have a main group discussion going over our organizational assessment. We'll be hearing from one of our subject matter experts on strategic planning. We'll follow with a break. We'll do the breakout session in small groups, and then we'll have a main group discussion afterwards, and then we'll see how fast the 2 hours go for us. Joining us today, we do have our subject matter experts. We have some returning faces. We have Dr. Sebastian Sempija. He is the CEO Clinical Director of Sebastian Family Psychology Practice in Glendale, Wisconsin. We also have Ms. Amy Carol Dominguez. She is currently the Director of Disaster Services at Crisis Emotional Care Team at Vibrant Emotional Health in New York City, New York. And we have returning Dr. Gaurav Mishra. Dr. Gaurav Mishra is a Chief Behavioral Health Officer at San Isidro Health in San Diego, California. And then we have Dr. Marlene Trujillo. She is joining us this second session. She is the Chief Executive Officer at Spring Branch Community Health Center out of Houston, Texas. And all of our subject matter experts are currently serving on our board or prospective board members. Joining us today, and they were part of all of the background work. We have with the RMTAC team, our producers and facilitators. So we have as producers, Diana Romero, Luz Chapa, Rosa Varela, Sonia Rollins, Talia Calderon, Titus Nunez. As facilitators, we have Aubrey Held, Ruben Ramos, myself, Teresa Quintana, and Dr. Mutsa Majero. Please note that we do have our titles, our roles, in front of our titles. In case you need anything, please feel free to reach out to any of these individuals. Thank you. So now let's get to know who is part of our learning community today. If you could take a few moments to put in the chat your name, your job title, your organization, and the location where you are at today. Welcome, Ms. Roxana. Can you add your, okay, neurofeedback advocacy project. Ooh, that sounds very interesting. And where are you located out of? In LA. Nice California weather today. Welcome, Dr. Brandon. Good morning, Amy. Hi, Mary Helen. Auxiliadora, welcome. Ileana, welcome. Virginia, welcome. And Kansas. And Trey, welcome. We have some people from all over. Christina Aguilar, welcome. So good representation throughout the US. So welcome everyone. We'll go ahead and continue. Isu, welcome. So we're going to jump into our icebreaker to get our interactions going for this activity. We are going to be using a Slido. So we're going to have the option right now. You can scan the QR code, or you can open a separate web page and go to slido.com. And here we have the code 1487186. And then I'll give you a moment to get that open. And then now think of the best supervisor or leader that you have witnessed. What qualities did they possess? So if you want to go ahead and put in your response. Christina, if you want to put your response on the chat, we'll take it from the chat. We can drop it in the Slido for you. We have trust and respect, vision, energy, ethics, clarity and communication, constant communication, transparency. So who put clarity and communication? Who was that answered that one? I like that one. Virginia, can you share a little bit about that individual?
Sure. You want me to share here?
Yeah.
Okay. Yeah, this was a supervisor that I had and was very clear verbally and in written message. Like she will explain, this is our plan, this is what we're going to do. And then she will go step by step. So that'll make me feel like we have a visual of what our task was, and also communicating verbally how she was expecting the product of that task. So I think that will make my job a lot easier than just having a general idea what it was supposed to be, what we're supposed to be doing.
I like that. I like that. You know, not just communicating, but giving a visual and making sure you understood. I really like that. How about who put sensitive to power dynamics?
I put that in there. It's Kisu.
Kisu, can you give us a little bit about details on that leader?
Sure. And I'll have my camera on in just a second. Sorry. Yeah, I think I remember a supervisor who was very mindful of just the different power dynamics within an organization and where she was in that hierarchy. And I think, yeah, supporting me in I guess my levels of confidence and assertiveness, and like boundaries, what that means within a power structure, have boundaries, and yeah. So
I like that. I like that, the levels. That's really, really good. Thank you so much. I had seen that somebody here had put that it was a choir teacher, I believe. So, you know, it doesn't always have a high school choir teacher. She saw talent and was always very encouraging, right? It doesn't always have to be like your supervisor, your boss, somebody who instills that leadership in you and those, you know, those qualities. We have some really, really good responses. A strong moral compass and empathy, knowing how to use the strengths of the team and supporting growth of both strengths and weaknesses, seeing the learning opportunities and creating opportunities for each employee. That individualization is very important. So great to hear. And I'm sure many of you organizational leaders possess some of these qualities. So great. Thank you so much, everyone, for sharing. So we'll go ahead and we'll continue. So we're going to go ahead and look at some of our key takeaways from the last session. For those of you who were on and those of you who had a chance to look at the recording. So we discussed how routine assessment within the capacity offers numerous benefits, right? Looking at what is going well and then what are some of the challenges that our organization might be having and how can we, as organizational leaders, play that crucial role in building the capacity for our organization. And then we discussed how collaboration can significantly enhance capacity building. And that's one of our main focuses for today, you know, continuing that we can work together so that we can better serve our refugees and migrants that our organization serves. Thank you. So as part of the takeaways and as part of the homework that we assigned, we did have the assessment tool, which we'll go over today. So I just wanted to go over it really quick. So this organizational capacity assessment tool helped us to prepare to look at what is some of the benefits of strategic planning, benchmarking, enhancing the communication, and identifying what are the training needs. So the capacities that were assessed by this tool was leadership, management and operations, service capacity, community engagement, and then the evaluative capacity. So we were able to take that assessment and look at our organization, and then it gave you a rubric results. In the next slide, it's showing you how the assessment was completed. So you took the number of statements marked not true, and then the number of statements marked NA, and then that gave you different percentages. So we're going to be focusing on which were the ones that gave us the biggest challenges, and these are going to be the ones that had the lowest percentages. Then our pre-reading article, we did look at capacity building for refugee mental health and resettlement, implementation and evaluating of cross-cultural trauma-informed care training. We sent that pre-reading article to you, and we chose this article because it taught us, or it explained to us how working and explaining to our team kind of what we were noting as some of the good leadership qualities that we've seen. Is, communicating to them the importance of the training and how this helps them be able to collaborate and work together. And so this is what we're going to be taking and to continue learning for today. Does anybody have any questions so far? Okay, so we'll go ahead and jump right in to session 2. This session will build on the insights from the previous session, and we'll also use the completed organizational assessment to start facilitating peer-to-peer collaboration, brainstorming to address capacity needs, and strategize what are the best practices to overcome any of the challenges that we identified. Our desired outcomes here is going to be self and organizational evaluation, collaborative learning and innovative problem solving, and then strategic planning. We do want to stress that to prepare us for the next session, we will be working on creating a strategic plan rough draft. Okay, so now we're going to go ahead and ask you to take out your assessment results. Go ahead and look at the rubric that you had and look at the 2 domains that had the lowest score. So these are going to be the 2 domains where you have the most capacity building to look at. Okay, so your 2 domains, now we're going to have you fill in this poll. What were the 2 domains for capacity building? So the 2 that scored the lowest on your rubric. So go ahead and pick 2 from this list, from leadership, management, operations, community engagement, service or evaluative capacity, and then go ahead and submit your response. Okay, so here we see our results. So we see as a group, we had service capacity, had the most, and then we have evaluative capacity that had the second biggest opportunity for capacity building. So let me just look at my notes really quick to look at some of the items that, it's service capacity. So service capacity looks at your program design, your program implementation, and your performance management. So we'll compare that right now to our previous results. And then evaluative capacity looks at evaluation planning, data collection, measuring impact, and evaluation, use, learning, and continuous improvement. So we will compare that now to our previous, the poll went away, to our previous rubric that we had created. So if you remember, during our brainstorming in the first session, we looked at what are some of the areas that we felt our organizations were some of the challenges. So we have here in the middle, we had data collection, funding, and cultural barriers. And then if you compare it over to the polling, to the poll that we just took, data collection would be part of our evaluative capacity. And then cultural barriers would be part of our service capacity, who we serve, who we help. So some of that falls in line. Some of the other ones that were highlighted were accessibility in rural areas. That would be our service capacity, scaling capacity, compliance versus quality. That goes back to our evaluative capacity, literacy, support, and then interpretation, translation services, which goes back to our service capacity. So we do see that there is some similarities between what we brainstormed and what our actual organizational assessment is showing. Anyone that would like to share what was your initial thoughts and then what were your actual results? Mary Helen, would you like to share? I know you had emailed me yesterday that you had it ready.
Oh yeah, sure. I'm happy to share. It was strange. This tool rated our community engagement as where we needed the most capacity building, but other external reviews we've had from other organizations and tools rated it as our most, our strength, our biggest strength. So I kind of got the opposite result from, and we've had external reviews, we have them a lot. But I found the tool to be extremely helpful for another project that I work on, which is a smaller community health clinic. So I guess it's different for different organizations and their stage of growth. So for the PRC and our Mental Health Alliance statewide, I found that it wasn't as helpful, but for the early stage clinic, nonprofit, smaller organization, when I use the tool to assess their needs there, I actually plan to type the whole thing up and take it to the next board meeting. So it was really helpful.
That's really, really good to hear. So that's what we want, we want to hear. So you haven't had a chance to complete it, right? For the second, for the small project that you said you had?
I did. I just typed up the whole thing.
Okay. And so did you think, were the results in line with what you felt were going to be the results?
Yes.
Oh, okay. Awesome. Okay. That's great. That's great. Anyone else would like to share?
I can share.
Oh, awesome.
My name is Christina Aguilar, and I am Coalition Coordinator for Refugee and Immigrant Service Providers Network of Tucson. And this is a relatively new role for me. I'm more used to doing direct service. And so this is one of my first indirect roles and more prevention versus intervention, using my community mental health skills. And so it was very informative to me in starting this role and in starting to develop and build a youth coalition and other aspects to our team to have these pointers to look at, to make sure that as we're building it, that all these factors are taken into account. And I think you don't always start with such a strong formula, and so I really appreciated having the skeleton of information, to make sure that all of these are checked and balanced. So
I like that, using it more as a guide when you're building. That's a really, really good point. Thank you so much.
thank you.
For sharing. Okay. So how can using the assessment tool benefit the process of strategic planning? So now what are the next steps that we're going to be looking at now that we have the results that we that we came up with from the assessment? So how can using the assessment tool benefit the process of strategic planning? Who would like to share of maybe some of your initial thoughts and plans?
I'll go ahead again because I'm happy to jump in. What I did is I rewrote the document and took certain parts of it out, and I'm I'm distributing it to our board. So I'm starting with our board because board engagement, and that's actually relevant to what is what the former speaker was just talking about. The board is responsible for making sure that the organization has all of the pieces in that are outlined. And so I rewrote the plan in a more positive, because in the way that it's in the tool, it's written that your organization does not have this or that. So I reframed all of the questions as positive statements for strategic planning objectives. So it kind of creates the actual document are the objectives that the board and the leadership will have to achieve to successfully create a strategic plan for the organization.
I like that. I like that. And if we can be of assistance, so we'll help with the strategy planning, but also we are very blessed that we have a very active board. So if that's something that we can help you with, and some of the ways that we've reached out to them and some of the ways that we've incorporated them into our learning and grant implementation, we would be more than happy to help with that. So that's great. Great to hear. Thank you so much for sharing. Someone else how can using the assessment tool benefit the process of strategic planning?
So I'll go ahead. I mean, I think one of the key pieces of using a tool like this really allows for us to evaluate kind of, as you mentioned, the last speaker mentioned, the objectives that we need to be focusing on in strategic planning, and then helps us to zoom out even further as how those objectives link up with our vision and the mission of the organization. So it's a prompting for kind of taking the implications of those objectives and zooming out even more. So I appreciate how when we're addressing each of these different categories, if there is a gap in leadership or a gap in management, the solves for those challenges help us point to the practical solutions. So I really appreciate how it allows for us to prioritize, and again, always linking back to what is our overall goal as an organization to fill these gaps and do well in the work.
Good. Thank you so much, Amy. And looking at the goals, and then one of the things that we'll discuss later is also where are our strengths, because this also right now we focused on what are the areas that have the most challenges or the most capacity building, but also looking at our strengths and what we're doing well. So thank you. Very insightful. Thank you. So now now that we've identified assessment as a beneficial tool, we will transition over to our next steps. Dr. Brandon will lead us through the rest of the session. Thank you all for your great participation and insight. Dr. Brandon, the floor is yours.
Thanks, Dr. Lizzie. So now we're going to transition a bit, as Dr. Lizzie said, for the next focus of today's session. We're going to begin brainstorming really how to address these specific capacity needs that you all identified through your assessment. And we're going to have some active, engaging breakout sessions later, and we're going to have some really helpful information shared by one of our SMEs as well. But start beginning to strategize and think about which specific area of capacity you would like to focus in on today, because part of today's breakout session is really talking about one of those capacity areas. I wish we had all that. And sorry, I wasn't ready for the poll yet, but that's okay. But yeah, but before we go in that process, let's just get a little background information from everyone. We want to know from you all first. Now we can launch the poll. And we want to know, one, does your organization have a strategic plan? So that'll be launched soon. And then two, if so, how familiar are you with the strategic plan? And if you're unsure whether your organization has a strategic plan, that's okay. Just let us know. All right, so looks like most of you answered yes. Some of you are unsure, and at least one organization doesn't have a strategic plan, and that's okay. Today's session and our next session will definitely help all of you who answer those response options. For those who do have a strategic plan, we have pretty even mix about those who are not familiar and then a varying degree of familiarity. That's okay. Really today's session is an introduction to strategic planning. And then, when we reconvene for our third session of this learning community, you'll have an opportunity to further reflect, modify, and maybe even create a strategic plan depending on where your organization currently is. So thanks for sharing all that. Okay, great. So now we're going to transition to our subject matter expert today, who's going to be talking about strategic planning. I'd like to introduce Dr. Gaurav Mishra. Dr. Gaurav Mishra grew up in Bangalore, India, and graduated from MS Ramaiah Medical College with an MD equivalent in 2007. He immigrated to the United States in 2009 after being accepted into a psychiatry residency at Wayne State University in Detroit, Michigan. Dr. Mishra is a board-certified child, adolescent, and adult psychiatrist, and he serves as the National Director of Behavioral Health for Wellness and Equity Alliance and the Chief Behavioral Health Officer at San Ysidro Health, a large FQHC in San Diego, California. Dr. Mishra has successfully implemented projects to create a continuum of services between primary care, behavioral health, and substance use disordered care. This includes a $4 million SAMHSA-funded Certified Community Behavioral Health Grant. Dr. Mishra is the project director or principal investigator for this project and is working on bringing a comprehensive mental health and substance use disordered care to seriously mentally ill patients in South Bay and East County, San Diego. In 2021, in coordination with several state and federal agencies, he organized and implemented a mental health services program serving over 3,000 unaccompanied minors at the San Diego Convention Center through a federal grant from the Office of Refugee Resettlement. So, Dr. Mishra, the floor is yours, and thank you for joining us today.
Thank you so much. That was, it was great hearing that, but also it reminded me a lot of the painful learnings that I had along the way. So, can you hear me okay?
Yes,
Okay.
we can. Yeah.
Okay. Thank you so much. Yeah. We can go to the next slide. Yeah. So I wanted to talk about, I'm tasked to talk about strategic planning today. And, I'll just say, even for myself, getting structure has been a huge part of some of the success I've been able to have with our team here at San Ysidro. My natural stance is like big picture vision person, but that is not enough. So we need a proper concrete strategic plan to actually implement our things. So I wanted to start with the definition. Strategic planning is an organization-wide effort to assess key influences, reinforce operating systems, establish objectives, mobilize staff and stakeholders, and to meet the challenges of a changing environment. And even if you think that you're looking at a small project within your department, I think having this broad picture is important because as we talk about, there's so many things that make a project successful. We can go to the next slide. So, a project is not just successful based on the idea, not just going to be successful just because you want to do the right thing. Wanting to do the right thing is obviously a great place for us to start, but you need to consider partners. You need to look at the finances. You need to look at the physical space. You need to look at the staff. Are the same staff that are already overworked going to do the new work that you plan to do? So all of those factors are important. So it is really important that you have a good planning process so that the implementation can be like you envision it. So broadly, the National Association of Health Centers has a framework that I use pretty often for creating a strategic plan. There is a portion of self-assessment of really looking at who are you and how do you get ready for a project and what are you aiming to do? And we'll go over the other portions of this as we move on, but the next steps would be an environmental scan, an impact evaluation, goal setting, and developing an action plan. We can go to the next slide. For self-assessment, RMTAC has chosen the AmeriCorps Organization Capacity Assessment Tool. And once you have identified the areas of work for your organization, the next step would be to do a SWOT analysis. So SWOT analysis is utilizing the strengths, weakness, opportunities, and threats framework. So this is, I think, a critical step in the strategic planning, where let's say you are looking at a particular project, you want to internally identify what is going to make you successful and what may hold you back. And I think an example here would be really helpful. I'll give you an example of our CCBHC clinic, which is a Certified Community Behavioral Health Clinic. This was a grant we received from SAMHSA. Actually, right at the beginning of the pandemic in 2020, we've continued that funding stream, luckily. And when you look at that project, the goal of the project was to be able to build a clinic where patients with serious mental illness, with co-occurring substance use disorder needs, and also complex social determinants of health factors in their lives could all be served within our federally qualified health center setting, which, typically FQHC settings, for people who know, are meant for mild to moderate patients. But all of us know that's not the reality. We see many more severe patients in our clinics. So my goal was to be able to do that properly so that our team can actually do the work really well. So our strengths were clearly our clinical work. As an FQHC, we have a very strong team of clinicians who are well trained, who are motivated, so that was clearly a strength, and I did not necessarily have to worry about that piece of it. However, there were several weaknesses. Our weaknesses have been, I think, operational readiness and having a robust operational structure so that this work can be done well, and all the different pieces that need to happen for the patient to have a good visit with their provider are taken care of. People say on average, one primary care physician needs 13 team members for their one visit to be successful. So there is a lot going on in the background for the work to be successful. So that was an area of traditionally we had not been most robust or clear in that. Opportunities of growth were really being able to serve more patients who had more severe illness within our organization, just because the county clinics where typically we would refer to were already overbooked and they were not available for months for our patients with severe illness. Our biggest threat, now again, threat is another critical piece to identify, was financial sustainability. This was within our current setting as an FQ, many of these positions that we would need, which would be case managers, the nurse, care coordinators, peer support specialists, other staff who are supporting the licensed clinicians are not billable providers. And so long-term sustainability is really a challenge. And keeping that in mind, even before we apply for the grant or receive the grant, was critical, knowing that could shut down our program. And it has in many situations, not in our place, but we know many organizations who have to shut down amazing programs because they had not planned for good financial sustainability. So this is, again, a critical step everybody should focus on. We can go to the next slide. I'm happy to stop for questions or just keep going as you said, Brandon. What your preference?
We're doing okay on time. So if anyone wants to jump in, you can, but feel free to go ahead, Dr. Mishra. It's up to you.
I think so. Once let's say the SWOT analysis and part of the internal readiness is part of their self-assessment stage. There are a few other steps left in our strategic planning. The next step is an environmental scan. What else is affecting us while we are trying to implement this project? Other organizations trying to do the same thing? Is there a new bill which may change the funding stream that may come down? What does the future of care for this particular population or this particular region look like? Those things are important to do. I think an important piece of an environmental scan is also doing a community health needs assessment, really talking to the people in the community who you're trying to serve. Our next stage goes to an impact evaluation. What does that state once you get there? What does that look like for the community? What does that look like for the team? You may think we want to do these amazing things, but let's think about our clinicians or our clinical team or support team who are serving these patients. Do they have the support to do the work? Do they have the right trainings to do the work? What impact that may have on retention of staff? And there's so many different impacts, that intentional and unintentional. Sometimes we talk about good intentional impact, but there are some unintentional impacts that may happen. So I think it is important to really think through some of these as you're planning. Our next step is the goal setting. So our goal was we want to create a clinic within our FQHC setting where patients can easily transition from their primary care physician to their mild to moderate level of care behavioral health clinic to our SMI clinic, or serious mental illness, SUD, co-occurring disorder clinic, the CCBHC. There's so many acronyms, I apologize, but CCBHC clinic and be able to transition back to our behavioral health or primary care clinic once stable, right? So that is the end state goal. And really the thinking through what does that require? And the final step was really what steps are you going to take? You really need a robust grant application. You need the HR team ready to support you because you need to hire a lot of people. You need measurable metrics. A lot of grants already do that, but you need your internal measurable metrics. And it really like using the SMART goal setting to really focus on how you're going to implement this, because this really gets you to stay on track and develop an action plan that is likely to be successful. Yeah, I do want to talk about, I've already spoken quite a bit about the CCBHC clinic, and I want to talk a little bit about the other two projects mentioned here. So the CCBHC clinic, as I said, was the management and operations capacity was the real sort of gap that we had to look at and weakness, an area of improvement. The naloxone distribution project, actually, this is one of the projects that I'm most proud of. The real area of focus was leadership capacity. So our addiction medicine team, which is within our department, wanted to procure naloxone, which for free through a grant, and distribute it to our patients across different clinical sites. It's a great idea, and by itself, the grant writing process, the receiving the items, going to a clinic and distributing it was not the challenge, because those are areas of strengths we already had. The challenge was the organizational culture and the leadership capacity. So there was definitely at that point a gap in our organization where not everybody understood the importance of integrated substance use disorder treatments in all of our settings. And even, the reality is even within the healthcare, thank you. I think this is my last slide, so we should be done in 5 minutes. So even within the healthcare setting, a lot of people do not really necessarily understand substance use disorders and the importance that plays in many of their patients' lives. So so our team was ready to go and just implement it, and I could foresee a lot of challenges because people were not prepared, people were not educated properly. So the first thing I had them do is really prepare a slide and a project goal, all the steps, and I had them present to our VP and VP of operations and CMO, who was our executive team leaders, and once they understood what the project is about and they had a buy-in, they would then champion this project for all of their teams in all of our over 50 clinics. And so because of doing that upfront and having that leadership buy-in and leadership understanding the role, when we implemented the project, it was really a huge success, because now we have patients who don't need a clinical appointment. They don't need to be our patient. They can walk through the door and front desk staff is prepared to hand over naloxone, life-saving medication. So it is really, the barrier was reduced, not just for our patients, but for our staff who could also get naloxone, because this is something that impacts all of our lives. The last one I'll speak about is Unaccompanied Minors Project. This was, again, in 2021, we got the opportunity to work on this project. There were about 3,500 kids housed in San Diego Convention Center, and we were tasked with providing mental health services for them. But this was in addition to our already, Monday to Friday job, and this was something that was going to be a challenge. However, it was an opportunity that had to be, we did want to say yes to, so we did. Within the first couple of days, we initially started providing groups for kids with clinicians, and we soon realized we did not really need clinicians to provide these groups. We brought in our case managers who got trained, and within 3 to 4 days, we had our case managers running groups. By the end of the week, this is, by the way, a 7-day a week endeavor for all of our team, well, many on our team. Within a week, we had case managers running 4 groups a day of 30 kids each. We were reaching over 100 kids a day. And 7 days a week, we were reaching over 800 kids every week. Now, if you look at those numbers versus traditional one-on-one therapy or psychiatry, which is impossible to get to 3,500 kids, even if I'd hired everybody in San Diego County, with this change in model and developing the service capacity, it really gave us a capacity to actually serve everybody. And that was the amazing differentiator that we brought in with the service capacity focus. Yeah, I think that's my last slide.
Can I ask a question?
Yes.
Thank you.
Yes.
Where did your population come from? Where did you get your students? Were they referrals, or how did you get the numbers to come in and do the classes?
Oh, we just we just asked our team, so you mean the staff who are doing the work, right? Is that
No,
all?
no, the
Oh, the kids
individuals
itself.
that you're serving.
Yeah, so this was, during the border crisis when kids were getting separated from adults at the border. So San Diego Convention Center by the Office of Refugee Resettlement was deemed as one of the sites where they were being held before
Okay,
reunification. So they were already being housed there. And
wonderful.
what we were told is go take care of their mental health, which is, uh, both exciting and terrifying to try to take over. But that's what happened there. Yeah.
Thank you.
Mhm.
Great. I think we have time for one more question, or we can jump into our 10-minute break. Does anyone have one more question? We have enough time. Okay, that's all right. Well, thank you, Dr. Mishra.
Thank you so much.
Very useful and helpful tips, and thanks for sharing how, some of these different capacity areas you've identified through different projects of your organization. It's very useful to see how, it's different depending on the scope and the type of the project. We'll now be taking a 10-minute break, everyone, and we'll return back here about 10 minutes. So thank you.
This is a good time to your little water flavoring or your little massage ball. Get yourself moving and going. Thank you all.
All right. Welcome back, everyone. Hopefully we have everyone back. Great. So while others are rejoining us from restrooms, refreshments, all that, let's just recap a bit so far, moving into the second half of today's session. So I think Dr. Mishra covered some useful tips about strategic planning, including the steps for successful strategic planning, which, he talked about self-assessment. With after that step, choosing a specific area or domain to focus, using a SWOT analysis as your framework for facilitating this process, as well as applying that to, if you're within a larger organization, maybe this is for specific projects or divisions. And we also talked about how the organizational tool for this learning community may be useful for that, and as might be useful for larger organizations to focus on specific projects or divisions. In addition to what Dr. Mishra has presented thus far, there's also approach of adaptive strategic planning as a response to 5-year strategic planning. Because of the fast pace of change in society with technology and just everything going on, it's almost impossible to forecast 5 years. So adaptive strategic planning balances an organization's long-term vision to guide decision making while prioritizing a 2 to 3 year plan with clear milestones. So really focusing in on a 2 to 3 year in terms of setting milestones and objectives. And a benefit of this approach is identification of resources in a shorter term, with the understanding that regulatory, technological, social, and political forces could make a 5-year plan obsolete. So that allows some flexibility, as well as, the remaining 2 years of a 5-year plan can be adaptive, framed, and aspirational, allowing for those adaptations and external forces. After today's session, we'll be sharing some of the templates, such as the SWOT analysis, as well as some other resources for strategic planning. And that's what we're going to be discussing today, in preparation for our third and final session, this learning community, is really to get you all to think about just broadly strategy planning. Today's small group discussion and collaboration, which we're going to jump into next, is really for you all to discuss a specific domain from that organizational assessment. So, earlier we took that poll, you identified, up to 2 domains earlier, but today we really want you to focus in on one of those areas for capacity. So whether it be, evaluation capacity, leadership, community engagement, service. I know that service capacity was the most responded to from the organizational assessment, followed by evaluation capacity. So just try to focus in on one for today, because that's what we're going to be discussing and coming up with different approaches and strategies to that. So just some logistics of how this breakout session is going to work. Each group will be guided by a facilitator, and there is going to be a subject matter expert in each of your room to help out as well. We'd like you to select one spokesperson from your group, because when we return back from the breakout session, each group is going to be able to share with everyone, just what was discussed and kind of summarizing the great information you're going to share with each other. So we're going to get started with the breakout session, and we prepared some guiding questions for you all to think about and to share with each other during these breakout sessions. So, just feel free to tell each other a little bit about your organization, just for enough context. Talk about which domain you chose and why, and then begin discussing, what area within this domain could benefit from strategic collaboration. And the facilitators will help you out throughout this process and get everyone to participate. But yeah, so let's go ahead and get started. We're going to be moving everyone into our breakout rooms. All right, welcome back, everyone. Great. So we gave you a little extra time because we know there was some good discussion happening. We want to remind you that we still have session 3, and we can build from these conversations today, as well as you can utilize our direct TA services for any assistance you may need. All right, so starting with group 1, we're going to have each group spokesperson share what was discussed in your breakout room. So, what were the areas of focus during the session? And maybe share at least one of the innovative approaches discussed. So we'll go ahead and start with group 1, whoever the spokesperson was for that. And we're also going to be sharing on the screen the whiteboard for group 1. So that should be loaded pretty soon.
So I can share. Hello, my name is Valentina. So in group 1, we mainly focused on 2 domains. That was the community engagement and then management and operations capacity. So briefly for the community engagement, that's where we had most of the discussions emphasizing on. And one of the key takeaways we had was that we need to hone more on the current partnerships we have and try to really build upon those relationships and fostering them, because it's very important that we leverage our present strengths before we can move on to other pieces that we would want to explore. So those were one of the things we talked about under community engagement.
Great, thanks, Valentina. Though it looks like you all had a really good discussion. There's a lot of strategies here. Just a reminder too, every group will get a clean and polished version of your group's whiteboard that will be sent out after the session. But yeah, thanks, Valentina. Great. All right, so group 2. Who was the spokesperson for group 2?
We're group 2, Kisa.
Okay, thanks. I was looking
Thank
to
you.
Teresa. Yes, I'm the spokesperson. So for our group, we identified 2 specific domains that we discussed, and it was the 3 of us who discussed it, Micah, myself, and Ausi with Teresa and Amy. And so for service capacity, the main focus areas, as you can see on there, are what does it look like to build up internal structures, ensuring that the services we offer are diverse and reflective of the community's needs and priorities, and how does that look like across different in Aussies, in my case, an organization that is quite broad, that works with partners and multiple sites. And then the last one was the need for written guidance, standard operating procedures, basically what can we do to ensure that there's a common understanding in terms of services. So that was one side of it. And then on the other side, in terms of evaluative capacity, data collection came up as a big one. And then also within data collection, I think the meaningfulness of the data, the ethics of the ways in which the data is collected, and how does it connect to, again, community and the clients that we serve, and the staff for collecting that data. And then under technology, skipped one, but under technology was also, do we have the infrastructure and also the funding to support data collection and evaluation activities. And so is that reflected in the budgets adequately, in staffing adequately? And then the last piece was on learning and reflection. And this was a point about once we have implemented a project or a program, there's reporting and all the things that go into that, but is there also an ability and time to reflect and learn beyond reporting back and incorporating those learnings and reflection as part of ways we evaluate our work. So that was the two for two.
Great, thank you, Kisu. Very helpful. All right, and our last group 3.
Group 3, actually, we thought we were group 4, but we'll be group 3. Cristina Aguilar from Tucson and La Frontera Centers will be our spokesperson. Cristina.
Hi, good morning. My name is Cristina Aguilar, and I'm a coalition coordinator, and I got to work with Roxana, who works with neurofeedback advocacy for the underserved, and Bailey, who works in North Dakota on refugee behavioral health and is a specialist in that. And we were very similar in that we were at the same stage in the newness of our roles. And so that was fascinating because despite our different scopes, we identified the same domains with community engagement and service capacity. And it was interesting how similar those were as we spoke, because in order to work with the service capacity, which was where Roxana was focused, you really have to know what it is you're doing. You have to educate on the services, and that has to happen at the community engagement piece too. So really knowing what it is that you're doing and having really definable ideas, and then identifying who your target audience is and being able to work with them, I think was our, I think we also came up with very similar language in that we have to, look at our community serviceable agencies, go on listening tours, and be able to tell the story. And so I think that came up in all 3 of ours.
Excellent. Great. Yeah, I'm glad to hear that you're all kind of in the same stage in terms of newness in your roles as you described. So excellent.
Thank you.
Thank you, Christina. Well, thanks everyone for sharing. We have just a few minutes left today for our session. We're kind of skipping some activities because there was really good discussion you all had. But one thing we want you to reflect on, and we'll certainly revisit this in session 3, is, consider how has this been beneficial for any new insights you have gained to address capacity or the specific capacity areas you identified today. Just think about that, and when we return for our session 3 and engage in strategic planning, we'll certainly discuss that in the beginning. But yeah, we can just provide a summary of what was all discussed today. So, we leveraged the different insights gained from the first session when we talked about the organizational assessment. So, from that assessment, you all were able to determine specific areas for capacity that could be improved. And we also learned that, based on Dr. Mishra's presentation from all of you sharing in the beginning, that the assessment could be used different ways within your organization and depending on the size of your organization. And it may be useful as a tool for sharing with leadership and boards of your organizations for creating specific objectives for your organization. So that was great to hear. We explored the role and importance of strategic planning. So again, we heard from Dr. Mishra on the importance of strategic planning, how that might look differently depending on specific projects and how you evaluate different strengths, weaknesses, opportunities, and threats to assist with capacity building. And then we had the opportunity to engage in this peer-to-peer collaborative learning process to address capacity needs. So, that's everything we just heard now about, community engagement and service capacity, evaluating current partnerships you have, looking at internal guidance with physicians and standard operating procedures, looking at evaluative capacity regarding data collection, and then back to the community engagement capacity and some of the things that Christina just mentioned. But yeah, I think you know, the insights gained from today's strategy collaboration will be useful in our next session, which will be all about developing a strategic plan or updating a strategic plan, and we'll be sending some resources after today's session to help you prepare you for that. Now I'd like to turn it over to Dr. Lizzie, who's going to provide some closing remarks as well as next steps to prepare for our final session of this learning community. Thank you.
Thank you, Dr. Brandon, for all your help co-hosting. So moving on to go ahead and close out this session, we do have our website is live and running and ready to receive your technical assistance and consultation request. We will be following up with an email. We'll send that to you. You do have the opportunity to submit a request, and you would just put your name, your email, your job title, where you're located, and then let us know if you'll be reaching out for assistance with strategy plan for your organization, if you would like to collaborate with one of the other participants here today. And you can also submit via an email at info@rmtac.org so that we can get that moving along for you, so we can help you with your strategic planning. We will also be sending out resources like we did at the end of the last session. It'll have the session summary and notes, the whiteboard collaborations. We're going to go in and review the recordings and make sure all the notes are updated before we send those out. And then we'll also be sharing with you the strategic plan templates. Any question? Let's go ahead and move on to the next slide. We would like for you to take the opportunity to complete our post-event survey. And I'd like to give you all a couple of moments to do that. We are SAMHSA funded and we need those surveys. We'll also be dropping the link in the chat. There you go. For those
It's
of
a
you
very short survey, so we really appreciate it. It helps us to continue this work and offer future learning communities in the future. So thank you.
Okay, let's go ahead and continue. Thank you so much, those of you who worked on the survey. So as a reminder, this is part 2 of our 3-part series. The next session will be to develop the strategic plan. We will be completing a strategic plan rough draft. We will be sending out the reading materials also to prepare for the 3rd session. And we have it tentatively set for Tuesday, October 15th at the same time from 10:30 to 12:30. So we'll be sending that out soon so that we can get you all started. I did put it in the chat. If for some reason some of you didn't receive our kit, our little kit to help you with the sessions, please reach out to me via email so that we can get that out to you. And now we will go to the last portion of our agenda. So we do have one more Slido. It's the same code, and these are for any questions that you may have regarding the sessions.
And we want to remind you too, for the homework for the strategic plan, that our team is available. Certainly your peers are available. If you'd like us to connect you with them after today's session, we certainly can do that. Just reach out and we're here along the way.
And if you don't want to use a Slido, you can put in the chat any questions that you may have.
And if you don't have any questions and you filled out the survey, we thank you again for attending our learning community and look forward to seeing you next time. Thanks, everyone.
Thank you all. Stay safe.